like I said, I think he should be here for reorganization.
Yeah,
So then could we do like, we could vote to do things out of order and.
Yeah, if we need to.
That's right.
Absolutely.
Yeah, okay. All right, I'd like to bring the April 6th, 2026 Bedford Board of Health meeting to order. All right, so we can start public comment. And is anybody?
We just have BTV and
me.
and you still want in? I still didn't let you get you in? Promote you, I tried to promote you.
Oh, there we go.
Okay. Oh, I think we were talking, so maybe it didn't. I'll look it up. So no one is there or here for public
All
comment.
right, well, let's just hang out for.
All right, we can do that.
yeah, now you're a panelist.
Hey.
Watch your
Careful,
step.
careful,
Watch
careful.
your public reports.
Yes. We just started and this pausing to allow any public to come on for public comment.
So there's still no one besides Dylan from Bedford TV.
All right, let's do one more minute. Okay. All right, I think.
Yeah, I didn't know we need the door open. Can we just close it a little bit?
Yeah, I don't think it's that much, but.
Just from a sound standpoint.
Yeah.
All right, does someone want to make well, we don't really have a motion to close public comment, right?
No.
So I would say let's close public comment. Okay, so our next one is our Board of Health reorganization, which is a normal process after town election to do every year. Do we want to, so what we usually do is we vote for we split it up for chair and for vice chair, right? So how do you want to start with chair?
Sure.
See if people are interested in the chairmanship. Anybody speak
I'd
up?
like to nominate Susan.
All right.
We need a second.
Second?
Yeah.
And I'd be interested, and I'd be interested in doing that.
Okay, great.
Right, and I think it'd be excellent. You're always so, you keep us on our toes. You're such a good, you always know what we need to discuss. You're very, so I really appreciate that. And also your willingness to kind of get your hands dirty, to really ask the right questions and all of that, so.
Yeah, well, I think we have a great team and I think. And we'll get into the vice chair in a second, but I like that we do it separately instead of a slate. And we look at the different roles, but it's a good group with staff and the board. And I think it's really just keeping us moving. We've done so much with different goals and initiatives. I think just keeping that continuity.
Yeah, that'd be great. All right, any other nominations? All right, I guess we can close the nominations. And vote. Yes, we'll close the nominations and the next step is now to vote. So all those in favor of Susan Schwartz being the next chair of the Board of Health for this coming, I don't know, it's, well, year, but it's until.
Yeah, for our year.
Yeah, for our year, until probably April sometime next year. All in favor? Aye. All opposed? Abstentions? Okay. 500.
Thank you.
Great, thank you. All right, so now do you take over right now and do the vice chair, I guess?
I do. And I'll start by thanking Bea.
Yes.
Good year. As chair, we accomplished a lot this past year and, your leadership really saw us through a lot. So thank you.
Oh, yeah. My pleasure.
And now nominations for vice chair, and like I said, we don't do it as a slate, but historically, the chair and the vice chair have really just worked in lockstep. And I'd like to nominate Maureen Ricci.
Excellent. Second, therefore,
Good, well, thank you, and I'd be interested, Susan and I have worked together before in these roles and had a good year, though I think we'd work well with anybody, we'd have a good year, because that's kind of our MO here, to have good years, so appreciate your support and thank you.
And I think we came up, the last time we were chair and co-chair together, vice chair together, we came up with the goals template, and I think we've just been able to proliferate that each year thereafter, and I look forward to doing more of that.
Yeah. Great.
Yeah, and of course, we will not leave you out.
Yes.
David. Next time. We figure we wouldn't,
Don't want it to go on shelves, no.
Definitely. So, any seconds?
Yeah.
You seconded it already. Anyone else, interested in vice chair? So hearing none others, all in favor of Maureen being the vice chair, say aye.
Aye.
Any opposed? Any abstentions?
no.
5-0. Congratulations. The other part of reorganization is the assignment of the liaisons. And as far as I'm aware, the only liaison that Anne was on was the RAB meeting. So that's a gap right now. The others, we can see if anyone wants to swap, but that's the one gap that we should try and fill before the next RAB meeting.
There's two, so there's annually typically two of them, one for Hanscom.
Yep.
Field, and then one for the Navy.
Right.
I mean, they're they're proximal. And just for everyone's information, it's just an opportunity for those entities responsible for the environmental cleanup at those two sites to report out what activities have taken place over the past year. If there's any new findings, for instance, like this past year was a big release of information and data surrounding the PFAS investigation, because that was the emerging, we heard from 2 years ago. They were looking to, look for that emerging contaminant, knowing how abundant it was within the environment. So there was a lot of data that came out about that and the next steps as far as that goes. So that will continue. The other site has not had a PFAS evaluation at this point, but anyway, more data continues to come. These sites are nowhere near to being cleaned up. But again, it's an opportunity for public involvement and for the Board of Health and for, health department staff.
And these meetings, I'm trying to remember, they're at least annual, but are
They've
they?
only been annual as far as
Okay.
during my tenure. Yeah, they're required.
They're annual.
Correct.
And
Correct,
you
right.
can be in person or via Zoom.
Yeah.
And Heidi, you attend them as well.
Typically,
right?
yeah, I'm typically there as well, right, yeah.
So it's RAB and HAT or
No, it's
both
just
RAB? Okay,
Yeah, they're both, yeah.
One's Hanscom and one's Navy.
okay.
So HATS is a separate entity, that's the
Okay.
Hanscom area town.
Committee.
S?
The S,
S.
select, or maybe it's select boards, because it's.
I don't know, I don't think it's an F, that's the S, but anyway, that's an organization of just community members
Okay.
from those Hanscom area towns that talk more about the environmental stuff. And then there's also for people from that organization that attend the RAB meeting as well.
So is there anyone interested in picking up the RAB meetings?
I wouldn't mind doing it as something, if there's a need for it right now, and
Great.
Doing great, thank you.
Yeah.
They
Thank you.
typically meet here, right?
Usually, well, they coordinate through me and I
Yes.
accept, I send everybody up in the Flint.
Right in this building, so it's not
Usually right here.
far or anything.
Right, right,
Or you
and
can
there's
just, yeah.
usually, and there is a Zoom option usually.
Yeah.
And so-
And then the only other item that Anne was working, would work on outside of our meetings typically are the IBCs. She is the community representative.
Is she still interested in doing?
She is, yeah, she is,
Okay.
and she
Oh, that's
has been
great.
attending as far as I know. and then of course, I think I mentioned to the group, maybe, or maybe it's in our report, that we were looking for the member to sit on the IAC
Oh, yeah, the IAC,
VA, and I
yeah.
think I've connected them, I don't know kind of where that sits. Again, that's not our bailiwick and not our, required, assignment of liaison, but I was trying to make those connections,
Yes.
so.
Right.
But yeah, I intend to, I expect that she'll continue on the IBCs, until, she lets us know she doesn't wanna do it anymore.
Okay, great.
And being on the IBCs, David, might be something also you're interested, but you don't have to be Board of Health for that, that's just
Yeah, it's
community.
just a.
And, the animal is for the VA, right?
Correct, yeah, the VA hospital, their laboratory there.
Maybe do we wanna quickly review what
What,
liaisons
we're on.
doing?
Yeah.
That would
do you wanna?
I'm not really on.
One, yeah.
So I'm on IBCs, which again, like I said, is not really a true
Do
liaison.
you know what IBCs are? Or we just doing
Institutional
that?
biosafety.
You're just throwing acronyms out.
No, that's public health for you.
Okay. I'm used to living in the world of TLAs.
Yeah, you got us there.
So we have a regulation in town, we have our biosafety regulation, I think you were here for some of
Oh, yeah.
those past, those meetings towards the very end of it. And there's a requirement for each of our permittees to host to hold an institutional biosafety committee meeting. And the intent is to, and it's a requirement, if you're receiving federal funds, you have to do one, our regulation makes you have to do one too, so regardless, so everybody's doing one, anyone that's permitted by the town, by the Board of Health here, has to hold a meeting. The new regulation requires that it happen at least every 2 years. Some because of the work that they do, or the agents that they're using, and materials they're using, we're doing them annually just because of the nature of the business or the risk level that they're operating under.
Right.
And we take a look at the types of materials, the risk level for each of the projects that they're working on, the biosafety level of that the work needs to be done under. And then we, they talk about like how they're meeting that requirement. They talk about the waste streams, how they're controlling the waste, how they're cleaning up after they've, done an experiment. And the intent of the community representative is really to be a layperson that's representing the community and questions that the community might have around it. They're not expected to be a lab person. So, and we've had a really nice grouping of people that have volunteered in the past, but the meeting itself is supposed to be run from a layperson's perspective. So they can be very interesting. You learn a lot about what's going on in this community. I mean, amazing, like life-changing work being done here. And I don't think we really know enough about it. Like the community doesn't necessarily know, all the good stuff that's done. Aside from when we talk about it here, I think when we have the opportunity to hear from Rebecca when she's reporting out too. So yeah, and we also have a contractor who does our safety inspections every year on our behalf, because that's not really my level of expertise on this, and our staff doesn't have that level of expertise, so.
Yeah, so like on those IBC meetings also, we'll review her report.
Yeah, because she
And
gives
her
recommendations and
recommendations,
suggestions,
exactly.
best practices,
Yeah.
et cetera, so. So if you're interested, then as one pops up, then we can have a conversation around who might be interested in sitting in on that. I can open it up to the group,
Yeah, that'd be great.
instead of me taking on number 9.
And
Always willing.
from a liaison, I am the liaison to the Youth and Family Services Committee. And then I sort of created a liaison to the COA board. Because even prior to being on the Board of Health, I would sit in on the COA board meetings. And then what I like is I sort of see youth and family and COA, so I have the full picture
Mhm.
of what we do. So those are the meetings that I attend.
So I'm not liaising to anything at this point.
Yeah, we don't have any other established
Right.
liaisons.
We had at one point a liaison to the Finance Committee. I know
Yes.
he comes to us, but we don't have one that
No,
goes.
It was the
other way.
boards, it was that committee, remember, it was,
Yes.
you did
Right.
sit on that.
Yeah,
It
and
was
I
the
did
committee,
too.
and you did as well.
Yeah.
It was the committee of like the non-select boards that would meet to
Yeah.
talk about financial stuff, I don't know if that committee still
That
meets.
was a thing that
Fiscal
Victor did,
planning,
Victor
fiscal
Galfalo did.
planning committee or something like
Yeah.
that.
Yeah, I
Yeah.
think they might be restarting that or something, I'm not
Oh.
sure.
No, we have a new finance director, so
Yeah.
perhaps that
Yeah.
is, perhaps that is in the works, I can find out about that
Yeah.
too.
If you
Is
can,
it-
because I
is it
really
okay
like
doing
being on that.
Those two, because that's a lot, you wanna split them out or?
I'm okay doing them, but if someone has an interest and wants to swap them out, that's fine with me too. I like it because it does give me both perspectives,
Okay.
but
Well,
if
if
you
ever
got-
anything comes up for you, I'll be your backup. You know what I mean? So that you can attend a meeting, yeah.
And then
So
often
it's
if the board has generated, like a statement or a consideration that they wanted to have another town department or town board
Then we
take
will-
up some public health, some issue from a public health perspective, you've championed those at
Yes.
those meetings and represented and such.
Yeah.
So I think
Yeah,
there's
you've been-
There's
there's always
also-
opportunity, speaking of town meeting.
Yeah,
They're just
right.
formal liaisons we have.
Yeah.
Yeah, that's true.
Yeah, and I think the only formal one we really have is youth and family.
That's in the bylaw,
Yeah,
aside from our regulation, which require, well, it's not even liaisons, those are requiring a representative from the
Mm-hmm.
health department.
Do we think it would be advantageous to have a liaison to the school committee? We talked about that in years
Yeah.
past, you know, we never
Hmm.
approached them about it, but they're the only
Mm.
other substantial town committee that I think we have some connection with, depending on what's going on.
yeah, and I was
Yeah.
thinking that, we got an email today that Heidi had forwarded to everyone, and I'm not sure, I know I haven't been able to look at it yet, but it was talking about student health. So that might be another bridge to have a liaison, but
Well, I didn't see that. Oh, you sent an
It
email?
was
No.
very late.
That was very
Oh,
late.
Just before this.
Yeah,
Just
it was
before
very
this
late.
meeting, okay.
Yeah.
But maybe, like, is there someone who's interested in?
Well, I might be, depending on, you know, how much is, I don't know if I could attend every school board meeting, but just given my background in student health in schools, you know, that.
I mean, as chair,
Yes.
is there an opportunity to reach out to them, you
I
think
can ask,
maybe, and
yeah,
ask,
and
reach
ask
out to
and say,
Sarah and
yeah.
see if, you know,
I don't even think, is it?
is it,
No, they go in
did they
June.
reorganize?
They go
They
June.
were, yeah, okay.
Yeah, I thought
Yeah,
they-
so it's
yeah.
there until June, yeah. So just check on that, if they'd be open to it, then I'd be interested, yeah.
Yeah, that's great, because there used to be long ago a committee, and that's, I think it was from the tobacco. It was funded through tobacco money,
Mm-hmm,
and it was about, you know, and I remember, so Board of Health was on it, and the police officer who is a liaison to the schools
Yep.
was
the
on it.
resource office, yeah,
And it was
Jeff
all
Weinbach,
talking
yeah.
about the curriculum.
Hmm,
You know,
that was
health
before my time,
curriculum,
yeah.
and
So that
anyway,
is-
but
yeah.
that was a long time
Yeah.
ago.
That was the health advisory. council.
Yeah, the Health Advisory Council,
Yeah.
yes.
And then there was a wellness committee that met, I sat on that, and that's what I was speaking of earlier, where they kind of reviewed the school health. Remember when the new guidelines came out about nutrition, like the school, the lunches that had to meet.
Well, I think it was,
standards?
when I was there with Youth and Family, it was the Health Advisory Council, Jeff
Okay.
Surprise.
Yes,
And then it morphed into a wellness committee, I think.
Yeah.
And I don't know if
Yeah.
it's still very active, though Cliff was saying with school start times that he wanted that under the wellness policy, but
Mm.
it's not a very robust policy. You know, it has a
Yeah.
couple of
You know,
statements
out
about nutrition.
to,
Yeah, see,
Sarah and
see if they're interested.
And the other thing is similarly to what happened with the COA board is we can just have someone attend their meetings.
Right, we can just do that too. Yep.
But I think it's important because we've sort of stretched where the Board of Health is over
Yeah.
the last, you know, like
Mhm.
since COVID and even before COVID, you know, we were trying to really just spread because everything impacts community health.
Well, I think given how involved the health department was during COVID and those
Yeah.
how our policies impacted, then I think that this is a natural.
Yeah, no, good.
So,
No, I'll follow up and I'll report back. And David, thank you for taking the run.
yes, thank you. Yeah.
Okay, Health Department staff reports.
Who
wants to go?
Reese,
me to
you wanna-
start?
Yeah, why don't
I
you
can
kick us
start.
off?
Okay. All right, so this month we had 9 annual food inspections. Although there were minimal violations observed, they were important ones. So, cross contamination with people taking out trash, not washing their hands before putting gloves on, not date marking foods in the refrigerator. Staff having open drinking containers while they're preparing foods. And actually, it's all on there, item
Yeah.
one, yeah. And again, we see the allergy posters are absent. I don't know why that keeps happening.
Yeah, I don't
And
understand.
the certificates as well, yeah, I'm not sure either. Also inaccessible hand washing sink bothers me because there's boxes and stuff in front of it, almost like they weren't gonna use it, so. We don't see this stuff all the time. I think this is maybe just staff kind of in a rush overlooking. We're gonna be honing this all in and going through some food safety awareness with Mogen. So this will
Yeah.
kind of just pull everything together. I'm not worried, I'm not concerned about this. And upon the re-inspections, everything was corrected, so I think they just kind of, brought themselves back in and moving right along. There was one food complaint inspection, but there were no violations observed, so somebody went to a restaurant, got sick. And then thought it might have been the restaurant, but we didn't receive any other complaints, and this is typical, we see this sometimes from month to month.
Yeah.
I don't even remember the last time we've ever received more than one complaint for something, it's usually, or like if there's two complaints, it's two people that were in the same household. And so
Interesting.
yeah, and there were no violations found, so, nothing came of that. The housing, inspections. Again, water intrusion that we've been seeing recently just from all of the snow and the
Ice
rain.
dams and stuff.
Yeah, so, the apartment complex was very fast to get going on that.
Hopefully that's resolved now, 'cause
It's
we should
resolved.
not have any more snow.
Yeah, yeah, well, don't say that.
Wait,
Don't say that.
we're supposed to get some tomorrow.
Oh, no.
Nothing accumulating.
Yeah.
Oh my gosh.
Good. So so on a happy front, there were no nuisance complaints.
Good.
Another really happy thing I wanna tell you is for hoarding re-inspections, sometimes these can go on for a very long time. But I have another one that is closing very soon.
Okay,
One
great.
just closed a month ago, in the
Yeah,
last
yeah,
meeting, so I have another one that will close within the next month or two, which is
Good.
fantastic. No hotel or motel complaints, so that's fantastic as well. And, for training, I'm still working on the hoarding cases, for the community. That's a 12-week program. I attended a focus group, participated in the Northeastern University Capstone and MAPC. So for people that don't know all the acronyms, Metropolitan Area Planning Council, just to discuss heat protections for Massachusetts, renters. So that explored barriers, and opportunities to improve access to cooling. So even though we might have cooling centers, not everybody's able to leave their apartment to go. Sometimes, we don't have the BLT running or,
Right.
it doesn't work out. So, bless you. I'll have more information on that next month too, to discuss on that. And the last thing I want to mention, which was a pretty exciting meeting I attended, it was the MHOA quarterly meeting. We talked all about the housing code regulations and housing court, but we actually had a judge there and we had clerks there, so we were able to pick their brains and just personally talk to them about different things that they've seen and how they, sort of how they rule. I mean, you could ask anything, so, and of
Yeah.
course, I had to have a lot of one-on-one with the judge after I had to ask all the questions that we might want to know. But it's fantastic, and actually, I think it's, because it can be intimidated for everybody.
Yeah.
So, and this made it a lot less intimidating,
Okay,
because they heavily rely on our inspection reports. And even though I've only been to court once, my inspection reports have been to court.
oh, okay.
I haven't been there, but they've made it there. And the judge has always thought our inspection reports are very thorough, so,
Oh, that's great.
yeah. But I thought that was exciting.
I was just impressed in the training, like I looked back not only on this report, but some of your previous reports. And the training being offered and that you're taking and then putting to use to benefit Bedford is so,
Yeah.
so thank you.
Thank you. Well, I love public health, so this doesn't feel like it's work to do the training. It's just giving me more information for my job.
But it's just, it's cool to say.
What's that?
So don't say that, they won't pay.
This is the season of trainings now too, though.
Yeah,
Spring
is
comes
it?
out and there's like
Is
so many trainings being offered this time of the year, yeah. So
Yeah.
lots of
Thank you.
opportunities, which is great.
Susan, for doing it.
No, definitely, it's cool to see.
Thank you.
So Jackie's not here today, she's on vacation, so I can go over a couple of highlights from her
Okay.
report.
Mhm.
That she's been doing some daily home visits for one particular resident, doing some medication management, but also while they're kind of doing some other wraparound services. So it's been a nice opportunity for her to support that individual. She did have 3 referrals to pulmonary clinics for latent TB, nothing active within the community. But again, it's a lot of, sometimes there's language barriers, also opportunities to facilitate rides and getting folks access to those locations. So there's a lot of back and forth through Maven, which is our online communicable disease registration system and management system, as well as telephone calls with hospitals and docs and stuff, and the resident themselves. So she does a fantastic job with that. We did our Impact Melanoma application again. We've been partners with them for several years now. Gosh, probably going on like, I don't know, eight or 9 years. That initiated through Emerson Hospital and kind of maintained through that now, although we have kind of as opposed to a dash line, more of a direct line to them.
Can I have a
And
question on that?
yes,
So I've raised this concern before, the dispensers
yes.
at the tot lot and
Yeah.
stuff. I just have a concern about, I know in schools, we were very clear about putting like sunscreen on, you couldn't without parent permission and stuff like that. So I don't know about, there are a lot of kids that use that tot lot when the parents are not there, and whether it'll just be overused or used incorrectly or played with, I don't know.
Well, what's the
Thanks for that.
experience so far? I mean, how many years have we had it there?
Oh, 8. Like I
Oh,
said,
have we?
we've
Oh, I
had
didn't
it there,
realize
like-
there.
Yes,
Oh,
we
yeah,
have.
oh, yeah, sorry, this is not, yeah,
This
that's
is
part of
not-
nothing new,
okay.
but like, and it's there as a resource to folks. We don't observe misuse.
Okay.
The
Great.
one thing, I mean, it does get used.
Does it?
So
Okay, great.
we are, the issues that we've had, our complaints that we've had, is that it's just kind of goopy, like, and so we've
Yes.
had to go and kind of just like clean it up and
Okay,
such.
great, okay.
Yeah, so we've kind of looked to have them at like areas where folks are outside and they might have been
Yeah.
like, oh, forgot to put the sunscreen on. So
Yes,
we wanted to make
great.
sure.
Yep.
But they can have access to that. And she's also working with our youth and family services folks on getting, having a presentation come in, with Hunter Flores and Olivia might know. This is, Olivia Dufour, she's our substance use prevention coordinator, so I should introduce her since she has a presentation coming up. But there's been quite a few folks who have popped up into the, onto our radar now that there's funding available for, looking at either preventative services or it's talking about their experiences and how they, how, as a youth or as an adult, how they got sober, but the process that they went through, and oftentimes they end up being coaches and such afterwards. So there's a bunch of different people. This guy's been around and he seems like a really, interesting speaker. So we're pursuing this as a joint prospect with the schools, and we would likely be able to use, we would be able to use opioid funds. It's just a matter of like what sort of, like he offers like a menu of things to provide, so we're trying to just sort of
Yeah.
trying to shape that out.
I went to that type of presentation in Lexington. It was a former, actually, brothers who had gone through the Lexington school system, and I had been using drugs and how they got there. It was very well received.
And they're great. We just we put a pause on it for just a little bit of time because we wanted to receive the data, right? We knew our data was coming, and we wanted to ensure that we were aligning with that. And we have some flexibility, but we wanted to make sure we were hitting those, top 3 or 4, 5 points, that the community expressed an interest in us focusing our funding expenditures on. So we'll be hearing more. We'll in a few minutes you'll hear more about that, but then we'll kind of see what some other programming is that we're thinking about. And then she's been in contact with the Trails Committee and Kristen, the engineer, environmental engineer for the community, about installing the tick marker. Oh, and John Campos from the Trails Committee about working on that the tick signs, the markers on the trails and such. You were thinking a little bit about this last time, but getting those up and running, and he had mocked up some things, so we have to just kind of figure out some funding for that and figure out how that can get, taken care of, so that we can, it's gonna allow, users of the trails, just access to the information, right? Just a reminder that they're there, I think by seeing the sign, and then click on the QR code and get some more like prevention, tick bite prevention, information around that.
Yeah, a question on that, Heidi. Is there an option to put maybe the URL or something for people who don't have a cell phone?
Oh, yeah, we would have to put I think it would probably be, if they don't have a cell phone, then they're not gonna be able to use a URL in the moment. So we would just put a phone number and have them
Yeah,
call us
or
with more
something.
information.
And I know there was talk at one point to talk about mosquitoes as well. Is this just for ticks along the trail?
We're shaking it out. We're still
Okay.
shaking it out. Yeah, but I mean, particularly on the trails, I mean, if you're using insect repellent on yourself when you go into the trails, you're gonna
You're
be
probably
covering
covering both.
covering
Yes.
yourself for both.
Yeah.
The trails issues is really about like, are you brushing up against the grasses? Are you
Right.
going off trail? Are you, biking in the,
Checking
and-
afterwards.
and then are you,
Yeah.
exactly, because you are in that environment, like out in the fields, not as much, if it's an open field or down at, the high school or out on the streets and such, but yeah, if you're in that dark, those little environments, that's really what we're trying to
Okay, cool.
kind of focus on here.
Historically, the greatest number of infectious diseases we have in town, other than like influenza, COVID, are tick-borne.
Tick-borne, yeah.
But all the tick-borne.
Yeah.
I have a couple of quick
Sure, go right,
questions.
yeah, go right ahead.
So,
Might take a shot.
for number one, so, talking about infection control at the VA, so is that just a normal thing that pops up and?
Yes, because it's
Okay.
communal living, right? It's like,
Yes.
and then you'll
Yeah.
recall from during COVID, like it
Oh,
was
yeah.
constant, right? And so like they do consider, and 3 cases or more right away that they're engaging with us on that. And we,
Okay.
even though it's a federal facility, again, how the whole, my whole spiel, like we have these 3 federal facilities in Bedford.
Mhm.
We don't have a lot of purview over them.
Right.
But we have a responsibility relative to the communicable diseases,
Yes.
particularly at the VA and at Hanscom. The third is a wildlife preserve. We don't
Yes.
have anyone living there, but for those other 2 locations, we have that responsibility to at least ensure that there's a connectivity
Yeah.
between the state, that the resident is actually doing the right process as far as getting treatment or, connection to services. So
Great.
that's.
No,
that's what
and that's
happens.
what I kind of thought, but I
Yeah.
thought I'd just check
Yeah,
in.
no, thank you. Yeah.
And then the other one, number 19, it's exciting about the possibility for getting an intern.
Yes.
Yeah.
So the
That's
state is in
great.
the process of of doing the interviews right now with all the applicants. They have an abundance of applicants. This is a paid internship through the state with using state funding.
Wonderful.
So they do get a lot, and historically, we have gotten requests from folks to come into the office and work, and we've put them to work, but it's hard to ask someone to work for free within your department. We've tried to find some money in the past to do that, but this is a really great program, and it's time consuming,
Yes.
to host someone and to provide that oversight and that engagement. But we've put together a really good program, we think, and we have a menu of items that we're looking to offer someone. We're just making sure that the individuals that come in have a connection to that. Actually, an email today came through from one of them looking for some clarification on like what that. We want an individual to do some education programming, like in person, stand up in front of a
Yeah,
crowd, do
yeah,
that, and
yes.
that takes, sometimes that can be a bit intimidating, but
Right.
it's also really good.
Right.
Really good experience to have too, if you're just starting out in your career, so to be continued, we are in the early stages. I think the preceptor like Q&A session or information session is the end of next month, so we should probably have someone in here by June.
Oh, great.
Yeah.
No, that's great.
Yeah.
Any other questions on Jackie's? I guess I have one, but anyone else? And I would have just said this if, she was here. Number 7, asking for an acknowledgement
Mhm.
back is a fantastic idea.
Oh, yeah.
Because she keeps, we've been running into the same problems. And now we're putting the onus
Yeah.
back on them. They've read it, they know what is needed, so great idea.
Yeah, she's done a really great job with that. It actually could be a model for other communities too, so I think we'll kind of look at that after she has, goes through a whole season this year of utilizing it to see if it's something that maybe we could roll out through MIHA or MHOA for future.
Right.
For other towns and other departments to take advantage of. She did a great job, and then, the communicable diseases, you see that when things are sort of, either decreasing with COVID, most definitely. And evening off with flu, there's that wacky strain, that's, what is the name of that strain?
Cicada.
Yeah, it's like,
Yeah.
it's like a cicada, is it a cicada?
It's cicada, like it comes out every 10 years.
Yeah.
like
Yeah,
that.
right, yeah, I know, so like, I think that's causing wreaking some havoc right now. Not quite sure vaccination really was.
Yeah, there's a lot of like
impactful
75
around that.
mutations or something on that.
Yeah, that
Yeah.
one's a little up there, so again,
It's
continue to
gonna-
wash your hands.
I've heard it's not too prevalent yet here.
Yeah.
In the US, but it's growing.
It's growing,
Yeah.
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 But
The other thing, speaking of things that are growing, I read that starting on April 1, communities and doctors have to report to the state about alpha-gal syndrome.
Oh, right,
They're
yes,
adding, yeah,
that was
it's
interesting.
Getting added to the communicable disease.
So can we have that added to?
It will be, once we
It
have
will
that,
be?
once we have, yeah, once we have it on the list officially.
Yes.
Yeah.
Yeah, that's great.
Hmm. Anything else from her report?
Nope.
No,
All right, I'll flip back to mine then and keep us a little bit on track here. So again, with the season of trainings and being able to access credit hours to maintain credentials, attended a septic seminar down in I did the MIHA one that's offered annually in Taunton. They do a really nice job. And always have a good lunch, so that's always a good. Good draw.
Food is a motivating factor.
It certainly is. Working with Susan and Jackie on the after action report to the tabletop exercise that Jackie attended with the chiefs. And certain member Sarah Dorr on just looking what mechanisms as to how we're going to improve, or if we've looked for gaps in our emergency preparedness planning and put some, identified some of those, and we can work on those over the course of the next year. We've had plans in place for decades now, so it's a little tough to find gaps in this day and age, but as times change and like how people access information, I think it's really good to kind of pick up the plans again and make sure that we're covering all those bases. So that'll be something that we'll plug away at as we work throughout the year. IBC meetings this month, or everybody's banging them out because they have their annual inspections with Karen and Rebecca coming up, and that's one of the boxes they need to check. So she's kind of keeping them in line by making, and then and me with the follow-up, making sure that they're getting those inspections and meetings in, I should say. Did meet with some of the proponents and town staff relative to the Carlisle Road project, which is still, moving forward. I think they're gonna have shovels in ground in about 30 to 45 days, I think is the
Wow.
initial site work
Okay.
getting done up there. So, talking about like the type of material with the code enforcement director before his retirement last week, talking about like what sort of needs to be in place, the hay bales and the barrier, the initial stuff, like making sure the initial roads are laid down with enough material that's not going to cause dust as they're coming and going. But wanted to make sure that the workers, although they're going to be installing drainage structures on site eventually, but making sure the workers are aware that that's a really heavy mosquito area up there, so that while they're working out there, that they're using appropriate precautions, checking for ticks and wearing bug spray for mosquitoes. So it was an opportunity for a little bit of public health outreach to our, not our residents necessarily, but folks
your
working in town, our
contractors.
contractors that are
That's great.
working in town. So they were very, very receptive to that and appreciated the connection on that particular topic. So, and lastly, but from my perspective, but not least, we had as I'm the representative from Bedford on the Massachusetts, the Massport Community Advisory Committee meeting. I reported in the past that we were working amongst the groups after Dr. Huda's presentation on the ultrafine particles and the data that she had collected in the spring and then the fall, over the winter and such. And then sort of what next steps might be. Well, every next step needed funding to consider what taking that next step. So I had met with the representatives from Lexington, Concord, and Lincoln, and we had said, okay, well, we're going to go to the executive committee and talk a little bit about how we could potentially get some funding through, we get this MCAC receives money from Massport to do this type of work, to do type of community engagement work. So I think they caught wind of our desire to want to do that, and then decided to kind of put a little bit of, not really brakes on it, but then wanted to establish a more formalized program for applying for funds, so that it could be there could be some equity to it, so that not just,
Yeah.
that just because Bedford has a, a project that's happening right now, like they wanna make sure that there's not stuff going on in other communities that might be as valuable. Have a deadline, have a review
Yeah.
process, similar to like any
Yeah.
grant
yeah.
application process. So I hope to hear more about that at the next meeting. I know Corinne Dowd is on the line
Yeah.
now, so I don't know if you wanted, if we wanted to offer an opportunity for her, cause I know this was something that she was interested in,
Yeah.
correct?
Yes,
Corinne, did you have anything do you mind if I bring her in?
No, that's
Okay,
fine.
Go ahead.
okay. If you wanted to speak, Corinne, I didn't know if you wanted to just hear what we were talking about, or if you wanted to speak, if you could just raise your hand. Cause Corinne was a member, is a member of partner entity, Mothers Up, is she Mothers Up Front?
yeah. He's also the handsome Jacks.
Oh, that's right,
Yes.
yeah, right, so, had interest in the topic, so,
Yeah.
anyway, she had reached out and wanted to know if we
Right.
were, what the board's next steps were going to be, and that's the action that we were able to take. I mean, funding through the town budget was not going to be sufficient or
Right.
even available with our small 2.5% that was, that we were offered, or the guideline that we were set at for this year. So thinking about what other funding might be available aside from going for some like larger outside grants, it seemed like a really good opportunity to take advantage of the MCAC. Again, they don't really have a formalized process at this point in the game, but we're sort of forcing that
Yeah.
process to happen, so.
Okay.
So here's
Raise your hand.
Corinne, yeah,
She did.
here's Corinne, and you can just unmute Corinne when you have a sec.
Hi, yes, thank you. I was just wondering, do you have any idea of the time estimate for their developing a formal process so you can move ahead with that?
Corinne, sorry, it's Susan. Can you just give your name and your address?
Yes, this is Corinne Dowd, 4 Redcoat Road in Bedford.
Thank you. Thank you. Now ask your question. Sorry about that.
So I was wondering, do you have an estimated timeline for, or, an idea of when they might develop a formal process for funding that you mentioned?
I don't, I mean, they meet, at least quarterly, so oftentimes every 2 months. So I look at it as my role to just make sure I can get some information from them as from the executive committee, as to how, what that timeline is. So I can acquire that and get back to you and get back to the board as well. But I don't have that information now.
Okay, great, thank you.
No, thank you, Corinne. Appreciate you asking that.
Yeah.
Because I think it was actually on all of our minds.
Yeah.
I know, but it came out of left field because we were like, okay, we're gonna get, we're gonna put the request through, and they're like, okay, everybody, we wanna make this equitable, so.
Yeah.
We had to be respectful of the process,
Yeah.
but, every year there's funding left over, or funding, projects are ending. You might recall, I reported out about the data collection project that they're working on. They built a website, and we saw a demo of the website for just Logan, but a level of data that they mined, that they've incorporated, and they're now connecting to this website that you can run various reports of like, all right, I heard a loud noise at 10:30 last night over my house. And then they can show you like, these are the flights that were going over.
really?
This is the airline there's a lot of like really amazing data, so that when you're going to file a complaint or to have a conversation, as a community member with Mathport to try to get
Yeah.
resolution, you actually have like real-time data. So,
Okay.
it was eye-opening, like, to say the least, but there's a lot more that's going to be built into it, and then they're gonna look to do it in the other Massport airports as well, but not Hanscom just yet. It's gonna be Logan first, so.
Right.
But anyway, that part of the project is tapering off, so there may be some funds that loosen up from that might be available to do some other testing.
Okay.
No, that's good. And it is a continuation of the conversations that we've been having. So that's good.
Yeah, it shouldn't preclude consideration for like interested groups to look for other funding too. Like,
Right.
that's something, this is one thing that we kind of came up with to do. I know, just funding in general is very difficult to come by, but I thought that, this is an opportunity, it came up as part of our conversations.
Yeah.
And Dr. Huda had done the work, the MCAC had sponsored some of her work
Yeah.
previously too, so.
Before we get to questions on your report, I just wanted to bring attention to number 13.
I was gonna do
Yes.
that.
Oh, yeah.
And that is celebrating your 15th year anniversary.
Yeah.
So thank you for everything you've
Yeah.
done. Congratulations.
Yeah.
to
Oh,
the
aren't you
Bedford
sweet? Isn't
community.
that nice?
Yeah.
It's been a pleasure. It's been
Yeah.
such a great, as my predecessor said, a plum of a job. He was very generous. He was very generous on his last day, we had a little crossover day that he afforded me right before he left and I started, and that, I'll never forget that.
Congratulations and thank you. And now, any questions on Heidi's report?
No, I was just gonna comment to that. Sometimes a plum of a job can mean you don't have to do too much, but that is not the case here.
No, that's not the case. I mean,
You
he
have
was
to work
thinking
very
it's just a
hard.
great place to work, you know,
Yeah,
really
yeah.
interesting, great, you know, and we've made, I think we've done a lot to expand upon that too.
Yeah.
Oh, yeah, definitely.
Very much.
No,
Your support as
definitely.
well, so thank you all.
I think, number 11, I think you've been talking about this, but so now it's really happening that we are gonna move from interface. Now into the Edinburgh, so
Correct.
that's really
It's different.
exciting.
It's not really, I mean, it's reassigning the funding to be able to
Yeah.
afford more hours through, like, more therapy hours here, like, you know,
Yeah.
opening up those spaces. Again, you know, a referral service has a little bit more, I don't want to say flexibility, specificity, right? Because if you're looking for some very specific, we have Ainsley, that's who's here for us, that
Yeah.
can serve us, right?
Yeah,
But if you want to have a person from a different gender or a different culture, or, you know, not in town, you know, that was sort of the benefit of the interface system. People just were not taking advantage of it.
Right.
We were, you know, advertising it every which way we could with, you know, on all of our brochures and in different ways. It just, I think it was a bit bulky, a bit time consuming to get access to services through that service. And even in the past couple of years, there's, you know, they've been we had our annual meeting with them and they would kind of lament about the fact that the numbers were going down. And, you know, that's why we had them come to Bedford Day, and they had a representation here at Bedford
Yeah.
Day and some other community events. It just wasn't,
Yeah.
you know, I think they need to maybe take another look at them, and there's a lot of competition.
I was just gonna say
So
that you've
there's-
got psychology today, you've got therapy matcher.
There are,
But
right?
You can just Google.
Oh,
You
okay.
can,
Yeah.
schools have the cartwheel
Yeah.
program that they've had, which is sort of simply similar in that way too, so.
Okay.
There's a lot that sort of popped up, I think, since the pandemic and realizing that, so I think, you know, whatever services, there's just other options. And we just really wanted to rebuild our local, our in-house therapy hours back to where they were, you know, in previous years, so we wanna make sure that we can get close to full-time on that.
Oh, that's great.
So this will help us, and we did get some additional funding in our budget, in the youth and family budget, to bolster that as well, so we'll be at full-time, but in the next fiscal year, so that's really exciting.
Any other questions on Heidi's
No.
report? Next is actually the Board of Health liaisons, and since I said I have two, I just want to bring them up quickly. Youth and Family Services, thank you to the community for the voting for the CPC money for the life skills
Mhm.
program.
Yeah.
Because that has been now, or will be expanded to any at need residents, regardless of where they're living in town, so that is great. Also, I just wanted to mention that Bedford as a community has been down a crossing guard. And
Oh.
a CERT volunteer has been helping at one of the three schools every afternoon. And that has helped both the schools and the police department out. So I just want to thank them.
Can I ask about that?
Sure,
Because that's concerning to me, you know, are they actively hiring or?
They are.
Okay, because I think that's a hard job and.
Yeah.
Not
Yeah, no,
necessarily,
they,
not necessarily a volunteer role.
No.
So,
we're just filling a gap right
Yeah.
now, as is this, the schools are filling the gap as well as the police
Okay.
department.
all right,
Yeah, and it's a short term.
okay.
We're filling that gap. And then also from the COA board, they are looking for more board members. And then I believe a new social worker has been hired.
Started today in
Oh,
COA,
excellent.
yeah, Kathleen.
And their focus is trying to get funding to, not the social workers focus, but the COA board is on medical rides.
Okay,
To help the community get to medical rides.
yeah.
So those were the things I just wanted to mention
Okay.
from those.
Great.
Olivia, I think you're up next.
Well, all right.
Hi everyone, thank you for having me. I'm super excited to be here. I'm glad I was able to make it in person. Just making sure that my slides share.
Did I allow you to share?
Yeah, there you go.
Yeah.
Oh, yeah.
They might end up being a little tiny, but I will also send them to Heidi to send out to you after this if you
Okay,
wanna take a quick
Great,
break.
great.
In addition to, we're gonna be putting together like a full report that you'll be able to have access to, but as I'll explain, there's a lot of moving parts to this, so thank you for your patience as we've been getting all of this done, but my name is Olivia. I work with the Bedford Health Department as well as 6 other health departments, which are Carlisle, Concord, Lincoln, Sudbury, Wayland, and Weston. Great Meadows Public Health Collaborative,
Yes.
GMPHC, that'll be another acronym for today. And my position is Regional Substance Use Prevention Coordinator, and so I've been hired by all 7 towns using their opioid abatement settlement fund money to help coordinate efforts around the opioid abatement settlement fund and also like coordinate with the communities to work together on spending their money in collaborative efforts, which is really exciting. So I've spent the last year working on this assessment, which included a survey, key informant interviews, and focus groups, which I'll talk more about in detail in the presentation. And now we're wrapping up the analysis. We'll have full reports to go out to the community. The hope is to also do some type of like community listening sessions, either at the regional level or local level, depending on what people are interested in. But I'm going around and kind of talking to our boards first and giving everybody a sneak peek about what we've been finding in the data. And so this is a timeline that I put together, and again, you'll be able to see this bigger on the slides when I send them out to you. But we're actually very on task right now, which is awesome because we have started our regional planning process with the advisory committee, which Heidi sits on and Jackie sits on. It's the health directors and public health nurses from all of my communities. And then we'll be working on presenting the data out to the community. I'll talk a little bit more about what CAB means. And yeah, it's just been a very busy and exciting and fulfilling process. So as far as the survey goes across the region, we got 1,012 survey responses, which I was really, really excited about. Bedford did a great job of meeting the goal number of surveys, so claps to Bedford. It was very well advertised. I believe we sent postcards out to every household, so there's definitely no shortage of opportunity for people to participate, which is awesome. As far as what came up in the survey, about 90% of folks who responded are residents of Bedford. So people were able to select multiple of these options, so the percents would add up to more than 100, that would be why. But about 90% were residents. We had a pretty good show out from town employees, which was awesome. And then we just kind of asked about a variety of different things, just to get an idea of what people's place was or what they felt that their place was in the community. Then we asked about folks' specific connection to the opioid epidemic. So we didn't get any responses from folks who identified as being in active use of opioids or in treatment, but we did have 3 folks who responded who are in recovery from opioid use. 30 or about 20% who are close to someone who's in active use treatment or recovery, so friends, family, other loved one. About 20% who had lost a loved one. About 20% again who work in a substance use profession, and only 34.2% of people indicated that they felt that they had no impact in their life from the opioid epidemic. And so, well, of course, you know, there's this piece of like, if you see a survey that says opioid use, probably if you have some type of impact, you're more likely to respond to that survey. So we can't necessarily say that this is representative of the actual demographics of the community on this topic. However, I do think that it's valuable data just to be able to say like, there are people in this community who are impacted by this issue. And we have the opportunity to do something about that.
One thing I would just want to let you know,
Yeah.
Jackie, actually, a number of us were at the townwide vaccination clinic. And as people were leaving, we asked them to do the survey as well. So it wasn't like they saw a flyer that said, please do this opioid survey. We just said, we have a survey that the community is doing, please take it. And a number of people did it then.
Oh, that's awesome.
Which is good.
Because we have that waiting period after you get your vaccination.
Exactly.
It kind of helps fill their time.
Near the candy bowl. They were happy already.
I need to start implementing more candy bowls. If I'm being so.
That's good.
That would help me as well,
Yeah.
but Yeah, so definitely seeing, you know, folks who have some connection, and trying to interface with them better. As far as age goes, we had a pretty normal distribution across ages, which was really good. We were able to hit folks in that kind of 35 to 54 range, which can be
Yeah.
pretty elusive when it comes to surveys.
Yeah.
So very happy to see that. The 26 to 34s weren't super interested, the 18 to 25s weren't super interested. This is, I think, pretty standard of what we see in public health research when it comes to average age of respondents. But again, we had a pretty good spread, which I was glad to see, because sometimes it really can be skewed in either direction. As far as gender, we did see a real skew on gender. This is again something that is incredibly common in public health research, where people who identify as female are just more likely to take a survey. So something to work on in the future. But again, all of these statistics are just to kind of again say we can't necessarily impose the results of this survey onto the broad population, because we aren't getting a good representation of what the population really looks like. As far as race and ethnicity, 97% of respondents identified as not Hispanic or Latino, 3% identifying as Hispanic or Latino. About 80% of our respondents were white, 5% were Asian, and 1% were Black or African American. So seeing a relatively good representation of what I saw in the census data. But again, in the future, as we're thinking about doing more work around this topic, trying to be a little bit more intentional with our recruitment of survey participants from underrepresented groups. Okay, so getting into our strategies, I think I can name them off the top of my head. The state gives us 7 priority strategies that are part of the national settlement agreement that we're allowed to spend the funds on. And so we asked folks to rate each of those strategies on a scale of 1 to 5, 1 being not so important to them, 5 being very important to them. Strategy 1 is related to support for treatment and recovery. So specifically things like paying for appointments or assisting somebody with, being able to get to their treatment appointments. Strategy 2 was support for people in treatment or recovery. So slightly different in that it's more about, if somebody needs assistance with housing or job assistance or things like that are kind of covered under there. Strategy 3 is connection to care, which is, early identification of potential opioid use disorder or early, connecting people with the services that they need better. Strategy 4 is harm reduction. So reduction in opioid related death. So that would be things like naloxone, syringe exchange. A lot of things fall under harm reduction. Just better education about, medication interactions, things like that. Strategy 5 is criminal justice involved persons. So specifically support for people who are involved in the criminal justice system, who are experiencing opioid use disorder, with getting better access to treatment and recovery and support when exiting or during prison or during their pretrial process. Strategy 6 is pregnant and parenting women with opioid use disorder, supporting those families. And strategy 7 is prevention, education, and anti-stigma campaigns. That was good. I'm actually kind of impressed.
Really?
I'm actually kind of impressed with myself, guys. I'm sorry. I just didn't
No, you were wrong.
I don't know if I was wrong, but I was on it. No notes over here. So as you can see, I spent a lot of time thinking about this, but also we had generally like a pretty good, like a lot of people ranked these things pretty highly. When it came to strategy 5, that tended to be the lowest across the region and within the regional data as well. I'll also be able to share the regional report with you when that's finished if you're interested.
Yeah.
And so, yeah, we didn't see like a ton of differences, but I'm going to get into some of the statistics. We looked at differences between specific groups and how they ranked the strategies, just to get a better idea, because part of the whole assessment process is thinking about making sure that we're taking into account the voice of folks who have some type of lived and living experience with the opioid epidemic, as they've been the most directly impacted. So thinking about how we can balance the whole community with the community of folks who've been the most directly impacted, and juggling all these different balls. And of course, just because a strategy was ranked a little lower doesn't mean that we can't touch on it. So many of these strategies are incredibly interlinked with one another, right? It's almost impossible to separate many of them from each other. And so pretty much everything that we do is gonna touch on multiple of these strategies regardless. But this is about the ranking that we had for our mean, median, and mode, and we also have to just note that the data wasn't normal, so the mean is like a little bit of a funky stat that we can't technically really rely on, which is why we reported all of them. Okay, so again, yeah, the caveat, we did have a low sample size for some of the specific groups, like we only had 3 folks who were in recovery, so when we're looking at that data, it's gonna be a little bit hard to actually get a sense of if there's differences between people in recovery or not. And I did have a lot of help with the statistics from our wonderful intern who's an MPH candidate at UMass Lowell. So I will answer questions to the best of my ability, but I might have to put a pin in it because my expertise is more in qualitative work that I will be sharing with you. So looking at strategy 3, connection to care, we looked at if the participant had any family experience with opioid use disorder. So had they lost a loved one or were they close to someone? And again, individuals who indicated did have a higher median ranking of strategy 3. So people who had family experience with opioid use disorder, the median response was a 5, whereas people without family experience, the median response was a 4. So they're pretty similar, but again, for folks who have that family experience, they were tending to rank connection to care as a higher, more important strategy than those who did not have family experience. So something to think about when we're making plans. And looking again at this, addressing the needs of criminal justice involved persons, which was our lowest strategy just kind of across the board in the region and in Bedford as well. We do see that people with family experience with opioid use disorder still have a higher median ranking. That's this black bar right here, and also had more of their answers concentrated towards the top, whereas here we see more of the answers concentrated between 2 and 4 with a median of 3. So if we're thinking about, how are we going to prioritize these things, we can't necessarily toss out criminal justice involved persons because generally across the board it had a low ranking. We have to be looking at these differences between people based on their specific experience. So those were the ones that had like a significant p-value. We did a lot of comparisons again because of the way that the data was. We weren't able to get a ton. The regional report will have a lot of these graphs in it because we had more data to work with. But just a couple that did actually end up coming up as significant in our report as we were looking at it. Okay, my bread and butter is the qualitative work that we did. So we ended up doing 6 focus groups. We had 1 focus group with people with lived and living experience that they themselves were in recovery. We had 2 focus groups with people who had supported or lost a loved one due to opioid use. We had 2 focus groups with people who had a professional connection but weren't necessarily directly working within our communities. It was a lot of people who were like researchers or worked at medical hospitals in Boston, but lived in our communities. So it was a little different than our key informant interviews. And then I had my group of concerned citizens who were people that indicated they wanted to participate in a focus group but didn't have a specific connection. I screened everybody to make sure that they knew what they were getting into. And then Bedford had 5 participants within our focus groups, which was really great. We had a pretty even spread across the board, which was good. Then we did except for Concord. Yeah, I was talking to them about it the other day. I was like, sorry guys, I don't know what happened. Because everybody had to self-volunteer and nobody from Concord did, which was too bad. And then we did 15 I did 15 key informant interviews. So 2 with police officers, 1 with a police social worker, 2 with medical and treatment professionals, 1 with a recovery professional, 2 community-based organizations, 1 council on aging, 4 people from schools, 1 fire department, and 1 faith leader.
Is that across the whole region?
Across the whole region.
Okay.
Yeah. So we did all the qualitative stuff regionally because if I had done 15 key informant interviews for 7 towns, I would be doing them until the end of this year.
I guess that.
So unfortunately, but yes, and then I'll show you. So we did interviews with 2 people from Bedford. And then we also had 4 of these interviews with people who kind of covered the whole region in some capacity. So I did a key informant interview with someone from Emerson Hospital. All of the towns in our region fall into their catchment area.
Yeah.
So looking at kind of that piece of it. And so then we had to take all of this data, which was so much wonderful data. We had to take the transcripts, upload them into this software called Deduce, which allows you to highlight things and then code them under specific different categories. And so here's just kind of a the bigger it is, the more times we coded it. So a lot of people talking about prevention, talking about treatment, talking about stigma, that came up a lot. We asked people about some of the effective strategies that they thought that we could implement. We had a lot of great conversation around that. We also asked people about like what strategies do they feel are ineffective. So we had some conversation about that. Potential programs in the schools, like looking at local government, how can we incentivize people to participate in our programs? Like trying to ask those questions to people. We asked a lot about what events in your community make you feel connected to your community, to try and think about how can we tap into these events that already exist, as opposed to trying to create something new. Because I think a lot of the time with this, the stigma is so prevalent that when we say opioid use, people are like, well, I don't need that, you know, like there's no need for me to be there. But if we're like already at another event that they're already at because they're interested in it for another reason, then they kind of have to talk to us. So trying to think about that. Bedford Day came up a lot with the participants from Bedford for sure. So I was there last year and I'll hopefully be able to be there this year again. But this was just really great. Like the conversations were so wonderful. And when we looked at the rankings of the qualitative data, prevention again came up at the top, which is across the region pretty much the case in the survey data as well. Treatment, connection to care, recovery, harm reduction. And then what was interesting is that supporting pregnant and parenting people was really high for a lot of our survey data, but didn't come up a lot in our qualitative data. Part of the reason that I think that is, I don't have any data to back this up, but I just think that for a lot of people, when you see pregnant or parenting women, you're not going to click one, right? Like it feels kind of icky to click one on that topic. So it might be some kind of bias there because we didn't see it come up in the qualitative data. But again, I don't have anything specifically to be able to say that that is the case. Some topics of note that came up, stigma was a huge one. It came up a ton in our survey, open response data, in the qualitative data that we collected. People talked a lot about what barriers they had to accessing services. So cost, wait times, not knowing where to go. We asked people about, you know, what makes you feel connected to your community. A lot of folks brought up things like their different community fairs, faith organizations, volunteering. A lot of misconceptions about substance use came up, more so in the survey data than in the qualitative data, but there was some in the qualitative data as well. But just like negative comments about people who are experiencing a substance use or opioid use disorder. So another opportunity that tells us that there's more work to be done in educating the population about what's going on. And then we also asked people where they access resources and information. Local libraries were a big one, health departments, Health and Human Services got quite a few shout outs. The Board of Health in Bedford got quite a few shout outs. People also mentioned like checking in with their doctor, just Googling. So lots of different ways that people are getting information and how can we tap into that better. Really trying to take like a look at the whole perspective. So there's a lot of data, but it's all really good stuff. So looking specifically at some of those open responses from the surveys, one of the questions we asked, we got 63 responses to in Bedford that said, how can we best address your concerns about opioid use? Somebody who identified as working in a profession that supports people impacted by opioid use disorder said, I believe we need to support prevention and education efforts as a priority. We should strengthen our existing access to treatment options. Concrete supports should be available to those in treatment and recovery. So emphasizing kind of those three topics of prevention, education, treatment, and then also supporting people who are in treatment. Somebody who knows someone who is impacted by opioid use disorder said focus on preventing opioid use, focus on building a healthy, thriving community with alternative supports for when people are struggling in pain so they don't seek out opioids.
That's awesome.
Yeah, so like really thoughtful responses. Like what I will say, just like kind of across the board in the region in Bedford, like just so many thoughtful responses, like people really engaging with the material, which I thought was so amazing. And was nice to see because I think a lot of the conversation tends to be around like negative perceptions and that people have a negative impact, but like we see so much like thoughtfulness and care put in that I think it is just nice to see, you know, it like makes me feel like, okay, we're doing something, like things are gonna happen and we can make a difference. We got 62 responses to the question, what do you feel is missing in our community to support individuals? Someone who is close to someone who is currently using in treatment or in recovery and lost a loved one to overdose said, A lack of understanding about opioid use within the community often results in limited or even non-existent support for individuals struggling with it. This lack of awareness can lead to stigma, isolation, and inadequate access to resources like treatment, harm reduction services, and mental health support, all of which are critical for recovery and prevention. So thinking about, how can we make the support that is available? Because there's a lot of resources in the region and in Bedford through Health and Human Services and Youth and Family Services and everything. But how can we just like make it more known that those resources exist? And then somebody who is close to someone who's currently using in treatment or in recovery just said, I am not familiar with what Bedford has to offer to support individuals. So again, thinking about how we can increase some of that awareness. I mean, that's like a constant public health struggle, right? We're not going to solve it overnight. But just things to think about, that not every lift we do with this has to be high cost. It can really just be like boosting the things that we already have that exist.
Which ties to our communications.
Yes,
and
yes.
The e-alerts and just the health department does a great job of posting things and making sure people are seeing it.
Yeah, which is
Yeah.
hard.
Yes.
Yeah, and especially in today's information age, when you're competing with so much. We had 52 responses to the question, are there any specific barriers or challenges you or a loved one has faced when accessing services or support? Someone who lost a loved one said not able to get immediate treatment when needed. This is something that came up a lot, was wait times and just like, there's that small window of opportunity that can sometimes come about. But if you're not able to access those services quickly, the opportunity can be missed. So thinking about how we can support that. And then someone who is close to someone currently using in treatment or in recovery and lost a loved one to overdose said stigma, transportation to and from resources, and continuity of care during long-term recovery. So again, thinking about that stigma piece, I think is going to be really important across the region, came up a ton. Transportation, as we all know, comes up a lot in a variety of ways. And just thinking about how we can better support our folks who are in recovery. I had a great conversation and a quote came from it with a recovery professional during the key informant interviews where he was talking about how the stigma of addiction and of active use, while also we should be working to break that stigma, but it really gets transposed onto folks who are in recovery, which is like theoretically, if you're using, this A to B logic of we want people who are addicted to not be suffering from active addiction anymore, but then when they are in recovery, we're still treating them with stigma and with some kind of shame. And so how can we better support folks who are in long-term recovery without that stigma and support them and celebrate them? And then HHS, when asked, where would you seek information on resources? Somebody who's close to someone and lost a loved one said HHS, which is really great that they would think to come here for that. And then somebody who was in recovery said that they have interacted with police departments, social workers, Alcoholics Anonymous, Al-Anon, NAMI, which is a mental health organization, suicide hotline, and various hospitals or clinics that offer treatment options. So there's lots of options out there. It's about connecting people with those options.
Can I just say something here?
Yeah.
I'm always amazed at, in this building anyway, in the restrooms with the tabs, how often
Oh, yeah, they're gone.
they are replacing them.
We have to-
That
we have to
that
replace
simple
them.
thing about taking the phone number, now whether
Yeah.
somebody calls, but that just.
We had those for years, and then when we got the Narcan, we added the Narcan, and then we,
Yes.
again, with the stigma perspective, putting it in the restroom. 'Cause
Right.
there's
Yes.
individual,
Yeah.
little
Mhm.
restrooms there, so yeah.
No, every time I go in, I'm like,
I know, I am
again.
too, I'm like,
It's
they're still
just-
pulled off. I
they're
know.
still pulled off.
And just for anyone who might be listening to this, please know that Bedford has in 8 different locations Narcan.
Yeah.
Available and in the bathroom. So
Yeah.
it's in hallways, it's in a number of different buildings.
Very comprehensive
Yeah.
naloxone distribution program in Bedford. I would like to applaud that. I'm working on getting some of my other communities up to your level, so very good job. Going forward, I'm going to be establishing the Safe Regional Task Force. So this would be a regional task force that would have representatives from all 7 communities that would help me determine our programming priorities for the region, specifically evaluate the success of our piloted programs and allow us to remain flexible. Because one thing I really don't want to do is we collected all this data and it's wonderful data. But I don't want it to be like, okay, and my hands are wiped clean and now we don't need to interface with the community at all anymore. How can we have an ongoing way for community members to be involved in this process? So this was the idea that we came up with. And so they would, the idea is that it would be formed of folks who have lived and living experience with the opioid epidemic.
Okay.
So they would be involved in decision making around the money. And I'll talk a little bit about some of the regional programs that we're pitching, and I'm gonna be coming up with a budget and bringing it to the directors in April, which is this month, so I need to start doing that. But based on the data, sort of our suggestions to the region, at least, are to start with the priorities of prevention and education, anti-stigma and harm reduction, and some treatment and recovery supports. For prevention and education, we want to do some community-wide presentations on the data, including some like things like this, but also some more maybe informal community forums. Work with schools and students to bring in relevant evidence-based programming. And then another idea was to work with our senior populations to do education around medication use, storage, and disposal, all of which are very important. For anti-stigma and harm reduction, we want to create spaces for community connection that do not center substance use. So this idea of like third spaces and sober curiosity, and how can we encourage people to spend time together and be in community together without having to be at a bar.
We just posted the event
Oh,
on
yeah.
our website.
I will
today.
talk about.
Yeah, I saw that.
Yeah, so we're doing a mocktail tasting is our
Yeah.
first event. It'll be in Weston. The plan is to kind of do events on a regular basis and rotate them to different locations around the region. But doing things like, karaoke. Like, when was the last time you got to do karaoke and you weren't in a bar?
Right.
Or, we'd pitch like an open mic night, board game night, like different things to bring people together in a space, and have fun where you're not having any substances. Expanding our Narcan access and training. I'm working on building a social media presence, and we'll have a newsletter for all the regional stuff so you can stay posted on what we've got going on. And yeah, so that event is called No Proof Required. It's on April 30th. We're working with a non-alcoholic spirit shop that's based out of East Hampton, Massachusetts. So it's like a liquor store, but everything in there is non-alcoholic, which is really cool. So I'm excited about that. For treatment and recovery support, we're looking at increasing awareness in the community about the supports that already exist, maybe engaging with some peer support through a local recovery center. And then one idea we're really excited about and hopefully going to be launching is some type of recovery scholarship. So people would be able to apply for a certain amount of money in a certain amount of time. We haven't set those parameters yet. And we would be able to pay for a month of sober living while they get on their feet and find a job, because maybe they left their treatment center. They don't have a place to live. They don't have money because they don't have a job. How are they supposed to pay for that first month's rent and sober living? So the idea would be that our committee of people who have lived and living experience would review those applications and determine how the funds get distributed. But that would be like all of our towns would put in some money, and then members of the community of all the towns would be able to apply for the funding.
And that money, would that come from the settlement money?
Yeah, that would come from the settlement money.
All of the, yes.
Oh,
work
that's
come
what
from that,
comes-
supported by that money.
Yeah, unless we apply for some extra grants.
Yeah, yeah, sure.
Who knows?
Sounds
I have
good.
a question, and I know you're working with the Great Meadows Collaborative, but I know there are other collaboratives in other towns. Are you talking to your counterpart for those other collaboratives?
Yeah, so we're the only, at least as far as I know, still the only collaborative that has a dedicated person on this. There are
Okay.
towns who have a lot of money coming in who hired a person just for their town. I actually started with my colleague counterpart in Framingham, a group of municipal people who are tasked with coordinating the funds, and we meet monthly. We talk about like what we're working on and what's been working,
That's
and we
good.
have people
Okay.
come in and give us presentations about different things that are going on. So really trying to be collaborative and not reinvent the wheel, because if somebody's already done a program, like I'm gonna be working, Natick has a really great example of the scholarship program. So I'm working on getting in touch with them to see what model they use. Because I think part of it is just like, why would we all do it ourselves when we
Right.
can do it together?
That's where I was coming from.
Yeah,
No, that's great.
yeah, so we're working on all of that. we're working on our data briefs and I'm gonna put together also like a 1-page version. Right now, the regional report is probably going to be like 50 pages long. So there's gonna be the full report for people who are really interested in reading all about it. I'm gonna make a shortened version of that report, that's the clip notes, and then also a 1-pager. So really trying to have different options for people to engage with the material. And then we're working on the regional planning, but I'm also here to assist with individual towns planning, so towns are able to put into the regional pot once we have our proposals official. But also can use the remainder of their money for like, if there's a Bedford specific program that Bedford would like to run, then you're also welcome to use the money for that. So I'll be working with everybody on like budgeting and planning, and it's all really exciting. Yay.
Do you think we could, when your reports come out, including that 1-page cheat sheet?
Yeah.
Just to publish that all in a Bedford Citizen, a long article,
Yeah.
so that even just the
Yeah.
cheat sheet was there, that 1-page cheat
Yeah.
sheet, that would just engage people and then say, here's the links to a,
Mhm.
you know, a bigger report or something
Yeah.
like that,
Mm.
but just so, I think that's one of the best ways to get people engaged with it, or at
Yeah.
least aware of what's going on.
And I think in addition to the Citizen, if we could put it out in social media and
Yeah,
then
oh, yes, no,
also,
always.
you know, like, it could be in Cliff's superintendent
Yeah.
report, the
Yeah.
COA newsletter, we could
Faith
try and,
organizations, their newsletters, yeah.
and just
everywhere.
push it out so everyone knows.
Yeah.
Mhm.
No, absolutely. Because I really want to be engaging, like everything's gonna have my contact information so people can get in touch
Yeah.
with me if they want to learn more. I do have people from the focus groups who are interested in staying involved, so
Great.
we already have a pool to kind of at least get
Mhm.
started with our
Yeah.
task force, regional task force. But I'm also gonna have an opportunity, you know, with the regional task force, we'll develop some type of system of like, how long can you be on the task force so that we can rotate people out and get fresh perspective, and then what does that process look like? Like all of that will be co-created with the people who are a part of the task force. It's modeled off of being a community advisory board, which is kind of like the gold standard in public health. But the word board is a little bit contentious as far as in municipal settings. So we didn't want it to get confused with something that was like officially chartered. But we are really excited to get that going. I'm really excited to get that going. I guess I can't speak for everyone.
Yeah, because
Yeah.
I mean, this is gonna be years long,
Yes, yeah,
right? So that's really,
yeah. So
that's great. So I imagine every year you do some kind of check-in or something on programs, right?
yes, yeah, so there will be some type of evaluation process set up as we start rolling out our programming, because we don't want to be investing money in things that
Right.
folks aren't accessing. So luckily what I focused on in my master's degree was all of this and evaluation,
Right.
and so
Okay.
I'm really excited to get to the evaluation part, because I think that's
Mhm.
really interesting.
Yeah.
But
Are there
we're-
any other programs across the nation that you can tap into in terms of ideas or outcomes or
Oh, for sure.
anything?
Yeah, I'm always trying to dig through the literature and figure out what people are doing that's evidence-based, because I think that is one of the things, is that things need to be evidence-based, informed, or promising. That we're not investing money in things that are brand new and we have no idea if they're gonna work.
Well, that's, I mean, that is a question. I mean, this whole opioid settlement is nationwide, right?
Yep. Yeah, and it's really interesting how different states are approaching it kind of differently. The way that the funds got distributed was, I can get on a soapbox about it. I won't, because I don't want to take up the rest of your meeting. But yeah, I'm happy.
To tap into the lessons learned from other states.
Yeah,
For successes, right?
yeah, no, I'm sure. And I think it's interesting to roll out across Massachusetts for sure, because every town has a different level of capacity for doing this work. I mean,
Yeah.
part of the reason why my job even exists is because for all of these 7 towns to scrounge up somebody who could dedicate some of their time, it wouldn't ever be like their full focus, because everybody's doing so much.
Mhm.
And
so-
your background in training.
Yeah.
and-
So we're pooling the ideas, you know, like, just like ticks and mosquitoes.
Yeah.
It doesn't know the town boundary.
Correct.
Yes.
So having a regional approach.
Yeah.
Oh, yeah.
We're
Just-
always telling
Oh,
people.
yeah, for
But
sure.
yeah, I mean, there's some like larger communities, you know, that have entire dedicated portions of their health department that are just substance use focused. And so they've been able to really hit the ground running, so I've been looking at their examples about what they've been doing. But I really wanted to make sure that we took the time to like gather all this data, look at it in a thoughtful way, bring it back to the community to make sure that we're using the money in ways that the community feels good about. Because the last thing that we want is to spend the money and then have people go, wait, what? And now we can say, well, look at all this like stuff that we did. So it's been really good.
No, it's great. Any questions going around?
No, sounds great, Olivia. Thank you for all this work. It's great to hear about it finally.
Yeah, thank you for your patience.
I mean, a whole
It's
year,
been a process.
just a year. All
Yeah.
this was gathered in
Yes,
one year.
yeah.
I mean,
Yeah, that's
It was a
amazing.
lot of work,
A
but
lot
like,
of
I mean,
work, yeah.
I find it remarkable that
Yes.
the great work that she did.
Yeah,
With Kaylee, the intern.
Yeah.
To really
Me and
give
my
us,
part-time intern.
well, to give us something to be able to now hang our hat on. Right now, we're
Yeah.
gonna spend the money in the appropriate ways. That our community wants us to do that.
yeah.
And if you don't have representation on that community board, and I'll use board in quotes, from Bedford,
Mhm.
let Heidi know.
Yeah, for sure.
like, Because, it seems like we were well represented
Yes.
in
Yeah.
the survey, in the qualitative sessions, the interviews. So I just want to make sure.
No, for sure. There
That
were
we are as
definitely
well.
a couple folks from Bedford who are in touch with me, which is awesome.
Great.
And we're super helpful. I mean, like, the qualitative work was really special to be a part of, like,
Mm.
just really wonderful conversations with people who are very kind and wanted to be involved, which I think is, just a nice balm to the soul. That
Yes.
people are
No,
These days.
nice job.
Yeah.
Yeah.
Yeah, so it's been really good. I'm really
Mhm.
happy, but I will give Heidi the slides so she can send them your way.
Great.
And then once the report is drafted, I'll be able to send that over to you as well.
Great.
Well, thank you for coming
Thank
in
you so
person
much.
tonight. This
And
is.
we to the different programs.
Yeah.
Yes, I'll be back.
Thank
I
you.
am gonna head out, but
Okay.
unless there's anything from me.
No,
You're good.
I have my next thing.
Oh, yeah.
Oh, it's there. Thank you, just in case. I did not.
so next on the agenda is the nomination of animal inspectors.
I can do it.
Can we make this Dave's first?
Yeah.
Yeah, Dave can do it. Go ahead.
Olivia, thank you.
Okay.
Thank you. Have a great night. You too.
And so as a little bit of background, we annually have to, we inspect barns, we have a local animal keeping of animals regulation. But the state actually, MDAR requires that the animal inspectors be nominated by the Board of Health and appointed. So that's what we're here to do tonight.
All right, I move that in accordance with Massachusetts General Laws, Chapter 129, Section 15, the Bedford Board of Health nominate the following 3 town employees and inspectors for animals for the year ending April 30th, 2027. Mike Laskowski, Inspector of Animals in the Bedford Police Department, Marissa Morello, our Assistant Health Director, and Heidi Porter, Director of Health and Human Services.
Seconded.
So moved by David and seconded by Maureen. All in favor?
Aye.
Any opposed? Any abstentions? 500. Congratulations.
Sorry, Heidi and Marissa. Congratulations.
Thank you, Marissa.
Thanks,
Thank
Marissa.
Next up is a whole bunch of meeting minutes.
Yeah.
And I just wanted to thank
Whoever did this.
Danielle, Heidi,
Danielle.
everyone who
Yeah.
worked on these. And I appreciate that what we have now is really a summary.
Yes,
Of
it's
the
so much
meeting.
easier to read.
Oh,
Oh, so much
Yeah.
easier.
Thank
It's a
you.
really good, it was great to go through.
David, we used to have almost verbatim, and it was just like, I would read back some of it, and I'd go, and I'd be like.
Okay, Daniel.
We gave you the thumbs up.
Yeah, she just gave us a thumbs up.
Oh,
But the idea is we do post the recording. Plus Bedford TV is typically at our meetings. So there are a number of ways that people need verbatim.
Here are
Yeah,
the words.
And it
are
doesn't
verbatim.
have to be.
and we can have them too, in case we're ever challenged for anything.
Exactly.
Well, I know what this helps me do is there were times that I went back to look at some minutes and
Oh,
I'd be
yeah.
like, you're reading through saying, where is it? Where, how do
Yeah,
I
yeah.
find this, you know, and
Yeah,
so.
but this is, yeah,
Much
this
better.
is really nice.
This
Yeah.
is really nice. So, Heidi, we can do all of them at once, right?
Yeah.
So,
Like-
I'm gonna start with just the November 24th, 25 minutes. Any changes?
No.
Any
No.
updates?
Nope. Not that I
Okay.
can remember.
The next one is, the December 15th, 2025.
I had just one thing.
Okay, what page?
So. The very end, there wasn't any documents and exhibits used during the meeting section. And I thought there would be because this is the one that we talked about the budget. So wouldn't the budget have been the document? That was discussed, used in that?
Yeah, probably.
Yeah,
So it's just one small little thing I just thought would be
Okay.
important.
and since we're on the end of that, bottom of page 2, the last thing where it says Board of Health meeting minutes from March 2nd, 2026, it should say December 15th.
Oh, right. Wait a minute. This is
The
the very,
very, very bottom.
right here. This is the December 15th. Yeah, December 15th, so you'll see.
She would update that, that's just the template language, so,
Okay.
yeah.
Oh,
It was
yeah.
okay on all the others, that's the only one I caught that on.
So well, and then we'll just add in, the budget review document.
Yeah.
The budget documents.
No other comments on the December 15th?
Nope.
December 29th.
No, I didn't have anything.
Anyone have, I just have, something small. Page 1. Where it's underlined, it says food establishment permit ratification, it should be
Oh,
5
five.
guys, not fiver.
Very good.
And the next bullet, or I guess it's not a bullet, pre-operational food inspections were completed on 7/10 and 7/11. Other than that. And sorry, one other thing, page 2. Under Ms. Porter outlined. The second bullet that says, number 2 nuisance complaints, the last sentence should say no violations noted.
Oh, yeah, instead of not violations. Very good.
But I echo what Maureen said, it's so much easier to read
Yes.
these, thank you. Any other comments on that one? February 2nd.
No comments. No comments for me.
I just have a couple. Page 1, under reports. The last bullet, tick bite prevention, the education campaign is underway and all trailheads will have.
Oh, we'll have, yes. That's good.
And page 3, the last sentence on page 3, where it says a new agree to agree. It should say, plans to finalize a yearly or semi-yearly schedule for releasing the content on a regular cadence instead of contact.
Mm.
I think that's all I had on that one.
Yeah.
No other comments?
No,
March 2nd, 2026.
no, I didn't have anything.
I had one comment on page 4. There's Article, you have Article 5, you have Project 6, then the next paragraph talks about the select board meeting. Was that in regards to Article 26?
Yes,
So that's just that header's missing there.
Oh, yeah. Oh, thank you for catching it.
yeah. Yeah.
Yeah,
So,
Okay.
and so above Dr. Brunkhorst, you're
Yes.
saying?
Yep, that's
Article 26.
right, because it looks like it's kind of a continuation of Project
Project
6 after
but it
Article
isn't.
6.
Perfect, thank you.
Thank you.
Perfect.
That's really great. Yeah.
Okay,
Oh, and you know what?
yep,
On that same page. When we made note of Anne's last day, she's just no E on her name, right? Like Dr. Anne, yeah, just, we'll send her off with her name spelled.
got
Something I will always miss since my wife has the E.
Yes. So, yeah, that's why I was looking, when, yeah, okay.
yep. And then March 19th,
That was all fine.
I just have one thing, page 1, second to last. Ms. Schwartz, who
Yeah.
drafted the proposal, noted that approval for hiring must consist of 1/3 vote of the Board of Health.
I have
It's a
the-
majority.
Majority.
It's a majority.
Vote.
Yeah.
Yes.
And so I
yes.
was questioning that, and I have that up on,
Right.
yes.
It's a majority.
Yeah.
Okay. Yep, the only thing I have on that one.
So anyone want to make a motion, to approve all of these minutes
I-
as amended?
I move that, we approve minutes of November 24th, 2025, December 15th, 2025, December 29th, 2025, February 2nd, 2026, and March 2nd, 2026, and March 19th, 2026 as amended.
Second. So moved by Maureen, seconded by Anita, all in favor? Aye. Anyone opposed? Abstain? 500, thank you.
Great job, Danielle.
Yay, yes.
Thank you.
Amazing, Danielle.
Alright.
And then number 8 on the agenda, I had talked to Heidi after town meeting where, the town voted approval for Article 26. And if you remember, after our last meeting, Matt had sent me an email which explained what approval meant.
Mhm.
And since the bylaw just says with the approval of the respective boards,
Yeah.
I wanted read into record what that means.
Yep.
Yes.
So that for any Board of Health going forward.
Yeah, they'll know.
Knows that. And then also, just as a reminder, we, as a community, voted approval of Article 26. That means at the next town election, it will come up for a
Right.
vote.
Right.
And then it has to go to the state.
Right.
So, we're talking at least a year and a half, right?
Don't leave us. So that's all done, huh?
I'm planning for 30.
Yeah.
I wouldn't if I were you.
Okay.
But, Heidi, in our packet, thank you for sending Article 26, but
Yeah.
then, I don't think we need to read that. into the
Yeah, I don't
record.
think so, but it's
But I
the,
did think that it was important to read into the record just what the town manager had sent me.
yes.
Starting with, I agree with your response, or?
Actually, Jay, I appreciate the thorough discussion.
So which,
It's the email from Matt,
Yeah,
me,
the whole whole email. you
the
mean.
whole email is what
Okay.
I was going to read in.
Okay,
Including the date
Yes,
and who wrote it?
Yes.
Thank you.
Okay,
Yep, so it was addressed to Susan Schwartz. It came from Matt Hanson, town manager, on Thursday, March 19th at 2:17 PM. I appreciate the thorough discussion the Board of Health had at last meeting regarding the upcoming charter clarifications. I agree with your response 100% when you stated, quote, "The Board of Health would deliberate and vote on a candidate separately from the hiring committee, and the candidate they do not vote for would not move forward in the hiring process," close quote. That is accurate and is what is meant by, quote, "approval," a vote. I understand the concerns regarding termination, and while the details of termination are not specified in the charter, Massachusetts public employees have a great deal of legal protections regarding the need to only be terminated for, quote, "cause," i.e. performance or lack of funding. Labor Council could provide more information on that if needed, and I'm sure that Michael Hugo or Cheryl Sabaro could clarify, unless they are more health policy attorneys rather than labor attorneys. I am not sure. In short, the health director could not be terminated by the town manager without cause, such as consistent poor performance evaluations by the Board of Health and or town manager, documented disciplinary issues, or lack of funding approved at town meeting. I hope that is helpful. Regards, Matt.
good.
And I appreciated that he had sent this, because that
No,
clarification.
it made me feel, I must say, made me feel, better about, the lack of approval for filing.
Right, or a process.
Or
or
lack of a
policy.
process or policy,
Yeah.
that there was no policy
Right.
written about.
Right, yeah,
And also what approval means for the hiring as
Right.
well.
right.
Mhm.
I thought it was very good.
Any other discussion on Article 26?
No.
No. So any updates of the Board of Health goals? Or discussion?
So I'm, well, I don't know, just remind me, so it was great looking at all these minutes, cause it reminded me of a couple of issues that we have a little bit here and there, and I don't know if some of them are exactly. But like the leaf blower things, cause you worked really hard on the leaf
Mhm.
blower. Did we ever hear back from the select board on the leaf blower?
I got an acknowledgement that that was received, and
Okay.
I think the last kind of discussion with the town manager was that when it would come up again, when it was of you know, when it was going to be an
Was it-
agenda item for the
okay.
select board, that they would include the Board of Health.
Okay.
in that in
I
that
just thought it was
conversation.
worth to.
Or invited to
I
that
was
meeting, you know.
watching because
Yeah,
that it
yeah.
hasn't been on agendas and
Yeah,
stuff like that,
right.
because if it was gonna be,
Right.
we would make a presence there.
That's right, no, that's
Yeah.
good. And then I was wondering about a food bank update. Maybe at next meeting?
Sure.
Could you do that? Cause I'm just, I'm thinking about the times, right?
Mhm.
The cost cutting, all this stuff
Oh, sure.
going on. And what the, part of the minutes reminded me was when we had talked about various things.
Yeah, no, happy to do
Okay.
that, yeah.
So I think that would be really timely. And then we had talked about, or you, I was trying to remember if it was you, Susan, comprehensive plan. Wasn't you?
No,
No.
I talked about.
Oh, it was you, I'm
comprehensive
sorry,
plan.
yeah. Any,
No, well, there are meetings this weekend for that
Right.
people can attend, but we're at
Mm-hmm.
MAHB, so I had that on my calendar to go to the comprehensive plan, but then
when
have
is
some-
it? When it's, cause I actually
there's something
decided
on
not to
Sunday,
go to MAHB.
so there's
but-
something on Saturday and there's something on Sunday.
But it's also the following weekend.
It's on the following
Oh,
weekend
okay,
too.
okay,
So there are opportunities, and I hope to have the one the next weekend.
okay.
But this one was, I feel that I wrote in my book, but I was like, darn, I think Sunday might have been like 11 o'clock in the morning.
Ah.
There are I believe it's 3 sessions
So on
each
Sunday,
day.
on Sunday, it's 9 to 11 or 3 to 5 is what I have written in my book.
It is, they're by topic.
Yeah. Oh,
So
maybe those are
9
the
to
ones I was
11
interested-
is safe, easy ways to get around.
Yeah.
12 to 2 is another one, and
3 to 5. There was.
3 to 5. So that's on
All
this
that's safe and
Sunday.
easy to get around?
No, no,
All
they're 3 different
There are six teams.
themes that came up.
And 3 of them are gonna be on this Sunday, and three of them are on,
So there's nothing on Saturday? Did I get that wrong? Huh, maybe I got that wrong. I just know I had.
I don't think-
Okay,
I don't think.
so maybe
that
it's the 2 Sundays then,
Right.
yeah.
Hmm.
And both of what you brought up actually aren't goals.
Oh, I
They were
know,
things we
I
were
know.
trying, but no, I'm glad you
Yeah.
raised them, but the
No, no,
comprehensive plan, there are working sessions. They encourage people to sign up for those working sessions,
Yeah.
but you don't have to, you can just show.
And at the last one they had in the large instruction room, right? When that Susan, you and I were at, I did go up to the consultant from the group that's driving this, working with the planning board on this, and just said Susan and I were here from the Board of Health, and that we were very interested in being involved in any way that they thought was
Okay,
appropriate,
good,
and so
great,
he wrote that
great.
down, and so, that's what we could do. Other than, on a formal basis in terms of this,
Mhm.
but there's nothing on any of those 6 themes that feel like, oh my gosh, that's a Board of Health related one. We're tangential to different things about
Right.
access, transportation, that type of
Well,
thing.
getting around.
Resilience, community,
Yeah,
community
resilience.
building, all that stuff is all part of our bailiwick. It's just that they're not specific
Specific
programs,
to-
Right.
specific to us.
But I think,
But we have good things to say about it.
yeah, I think it's important for the Board of Health to weigh in either individually or
Right.
collectively.
Right.
Well,
Whenever.
are there specific sessions we just want to make sure somebody can be at? Just to make sure our voice is heard?
I don't know, Heidi, can you bring up the comprehensive plan page?
Try.
To go to the planning
The
page.
internet's not being particularly.
Yeah.
Supportive of me, like accessing the different people, like. See if it'll let me go down. To do it this way.
I'm surprised they were doing it next weekend because that's the long weekend, right, and it's school vacation and everything like that, right?
Whole
So,
camping.
Yeah, they
Yeah, next week? So,
no,
Is
the
it-
following, I mean, the weekend
Oh,
after
the
this
second,
one
yes.
coming,
Is this what
yes.
you want, or you want the?
You know,
I think you should go to the
cafe,
Hard
right?
Rock.
That's Polk County Saturday, the 11th.
Yeah.
So the town manager is collecting staff comments on the plan too.
Good.
Oh,
okay.
right.
RSVP strategy workshops, yeah. I think if you continue.
Yeah.
Here, draft themes and goals.
No,
That's,
keep on
that's,
going.
that's interesting to read, and maybe we should
Yeah.
just put this link in. our-
But hold on, how the sessions work, keep on.
Sessions.
All 3 on the 18th.
And then Saturday, the 18th, yeah, I didn't think it was the 19th, okay. I knew it was.
But I wanted to
Saturday.
get, here's theme one, right?
Oh,
Yes.
yeah. That's
Easy, safe ways to get around, so that's 9 to 11.
So this is something that has been an ongoing topic, I mean, from a
Yeah.
health department engaged, youth and family services, safe routes to school.
Okay, this is
everybody-
us. That's the board.
That's the board,
everybody.
everybody.
Yeah,
Yeah.
Vibrant village centers and a stronger local economy.
Yeah, that's why I didn't write this one down, it wasn't. No, I'm just saying, I
Yeah.
didn't have a lot
No, yeah.
to say on this, but, it's not my most thing.
Time, history.
I will say though that this, like, there is crossover, right? Cause I was thinking of this as my comments back, like this theme too of like stronger village centers, like vibrant village centers.
Yeah.
Again,
Gathering
that's that
places.
communication
Gathering.
of-
Strong sense of place.
Strong sense, no, they all connect.
But like thinking
Yeah.
about the loneliness epidemic, right?
Yeah.
And how we have the loneliness,
Yes.
but the
Right.
happy to talk benches and thinking about that. As being, sorry.
So that one, okay, that's good to see.
yeah, I
It's
put
on
them all on
Sunday.
my calendar, I'm not sure
Yeah.
I can go to.
Homes that support choice, dignity and belonging. I mean, again, right, accessibility. I mean, this topic came up a lot of town meeting too.
Yeah,
Yeah.
no.
Yes.
Shared spaces again,
Yeah, oh,
okay.
I mean,
Yeah, again, I think it's approaching it from different
yeah.
angles.
Outdoor recreation,
Oh, yeah, that's because we have a goal on that,
yeah,
but more, it was more
intergenerational.
intergenerational outdoor recreation. Okay, that's Saturday the 18th. All right, well, I'll look at
Yeah.
and let's see. Maybe.
Yeah, and the request is that people RSVP, so they get a sense.
Right,
But if you can't, I can't imagine.
They're gonna turn you away, right,
If
yes.
there's so many people, there's not doing it for.
They said, the other reason they said RSVP is there's some material they would send out to you, so,
Oh, that's nice.
yeah,
Yeah.
so.
No, I'm glad
You
you
know,
raised that.
I think, moving forward during this year, it'd be worthwhile on each agenda having a place setting for this, if there was something that was coming up. You know, that we look at it
Oh,
every month
yeah,
to say, was there anything that came out of these, or that gets reported that we wanna comment on, you know, and just, it doesn't have to be every meeting, but just.
You mean the comprehensive plan?
The
or-
Yeah.
comprehensive plan, just saying, you know, any way that we can intersect with what's going on, you know.
Just to keep
Just to
keep an
keep-
eye on it.
Keep an eye on
Yeah.
it, right?
yeah.
But the other thing is, actually, when you started talking, I was thinking almost a schedule of things going on in the community. Just to raise attention. So Heidi mentioned about, community spaces and methods to fight loneliness.
Mhm.
They're the community dinners.
Right.
Yeah,
I know that, for one of them, anyone who was running for, a public office was invited. I've gone to some of them. I would encourage anyone in the community to attend
Yeah,
that. And is I was almost thinking an agenda item could be upcoming events that people might not be aware of that have a health impact.
Mm-hmm.
yeah.
There is an event on April 30th, sponsored by the Parents Diversity Council on, it's a community training on anti-Semitism.
Oh,
oh,
nice.
all right.
And that's open to
Oh,
anyone.
oh, okay.
Wow, that's great.
And, it would be good to get a section of the community.
I'm very anxious about, I guess is one word, and interested in whatever happens in the next year or so as they start talking about the old fire station.
Yeah.
Because I'm hoping that it's gonna be a very transparent process
Oh, yeah.
in town here. You know, I hear some rumblings of, oh, go for this, or it'll be this, and I think it needs to be
You saw-
wide open.
You saw the Citizen written last week, right?
Yeah.
Yeah,
So
Luigi.
Luigi.
Is that only first?
It got me for a
Yes, it
minute.
was.
It got me for a minute. I said it got me for a minute. I was like,
Yeah. Yeah, I know, and then I see the scallion. I'm like,
yes, yeah.
Oh, okay.
But I think that brought it to mind again, because every time I drive past, I
Yeah.
think I know there are a lot of groups that are vying for it, and I think it just needs to
Has
the
a-
community needs to
needs to
have a
have
say.
fair, open.
Needs to have a say in
Yeah.
what happens to that, as opposed to
Yes.
it being a decision made.
Well,
by the
like this
select-
process.
Yes,
We just went through,
exactly.
it, right? Like, we
It's
need,
so good.
we have they had the survey, as we know, from like 3 years ago now, 4 years ago. The consultant they hired, the town hired to
Yeah, space needs.
evaluate, they did the space needs, right? Did space needs and then
Right.
evaluate, they made recommendations to the then select board and I believe then town manager on, what the recommendations were. Like, does it still hold true 4
Well,
years
that's-
later?
That's the
Yeah.
question.
Right.
You know?
And again, I think because of how public and how much money is going into the new station and all that, that everyone's very aware of this space, where sometimes people aren't aware of,
Right.
That's true.
like an area in town center that's available, or something that has to change in town hall, or the facilities has to move around, or something. This is just a very public, on the common, in that center,
Yeah,
town center area that we're trying to build up and make it so that I'm hoping that whatever goes in there is something that
it's community.
that
Right.
is real
Yeah.
community focused and not an extension of a space need for necessarily a town department. It might be that people say in town, yes, we like, say, the food bank. Yes, we think the food bank is really important and it should be there, but there should be some kind of a say, or there should be some kind of a process. That's all
Yeah.
I think is really important. I think because of how people were involved in the choice to move it, the
Right.
cost to move it.
Well, does the
And-
Board of Health wanna send them a letter to the select board to that effect, like that they're interested in like engaging or like being a part of the discussion, or just looking to learn more about what the process is going to be? I don't know how you would find out, I mean.
Let's talk about that further. I mean, let's think about, you know, whether we have a role is just to saying that we're hoping that this is really transparent and something that the process itself builds community as people come
Yes,
together
yes.
to decide, prioritize what people want now. And that something from 4 years ago, you're right, Heidi, might not be appropriate
yeah.
now, you know, it might be, that might, even though that's available space, that might not be the
'Cause
best space
That
for
was during
something.
COVID, right?
It was
It's
just after.
Just after
Just
that.
after COVID.
But it's
20
almost like
20,
Wilson
23.
Park, where there is a community group,
There is,
Working-
that's what I think there ought to be, a community
Yeah.
group.
working with, DPW in that case for Wilson Park, and
Where this should be working with town departments and community
Exactly.
groups to get feedback and to get, you know, what people, because I think it's the kind, because of its location right there. This just needs to have a sense of ownership, like we
Yeah.
decided this. I think that would be.
Yeah.
do you want to take a stab at a letter that we could write, and we can discuss it next time? Is it, you know, like, if
Well,
we
I don't know if
have a,
this is the most, I'm wondering what's the scuttlebutt, like when is something gonna be decided?
Well, how about if I just inquire?
Can you
Like,
just-
on the
okay,
town
that would be
manager,
great.
have
That
one
would be
with
great.
the town
Start with
manager
that.
office and
Yes,
see
and
what I
just
can
say,
find out.
what's the
Yeah.
timeline for figuring out
Yeah.
something, because,
Yeah.
yes,
and it's the process.
and what's the process, and then, yes, we can weigh in on it,
Yeah,
yes.
Great, oh, thank you, that's really good.
They may wanna wait until they're a little closer to actually having them move out, so they don't have people traipsing through the fire
Well,
station going.
that, you know,
Yeah.
that is part of it. That is part, it's about being, I think, I mean, from my perspective, it's about being respectful to the firefighters and to the fire
Yes.
department that are there now, and not, you know, hey, guys, you got this brand new building, like, hey, when are you going? When are you going? When are you
No.
going? No, I'm saying, but
Yes.
I think that's why I think you're not hearing too
What the space could be used for, like,
Yes.
what remediation has to happen for
Right.
chemical use in there.
Again, and all of that, I feel like there's a concept, I think
It's a
there's gotta be an opportunity to strike that balance.
Yeah.
Because you don't want people to feel like they're being pushed out.
Yeah.
Right.
I mean,
I don't,
Oh, yeah,
think
yeah.
it's down, and at the same time, what I'm talking about is, I
Being
don't
efficient.
want that all of a sudden this
Decision.
top-down decision about we're gonna use.
well, it's an
it for
empty
this.
shell, and this is the easiest thing to fit in there,
Right.
or this is,
Yeah.
what
So
our immediate needs.
Then I
right
don't
now.
care, even if it takes another year to figure this out, or to take the time, it's worth doing, is what I'm saying, we
And,
don't
well,
have
again, if
available
the
space.
process is mapped out so that people
Yes.
are aware.
Okay.
There's-
no one wants is a surprise.
Yes.
Or I'd want something you go, what?
Or
I
knee
just-
jerk, I
a
mean, or
knee
knee
jerk,
jerk, because
right.
there's a sudden need, or we're gonna do this, and then it never moves out, like,
So-
move in now, and then.
So that's, Heidi, if you would.
I'll
just
find out, yeah,
ask
I'll
them,
inquire.
and then we can decide, you know,
Yeah.
your point, it might not be urgent, it might not be, we need to say anything for another 6, 8, 9 months, but I just wanted it on our radar.
Yeah,
You know,
no, that's good.
Yeah.
Anything else that, either a goal update or another topic that we wanna broach now?
The only thing I would say is, do we want a carpool on Saturday? Who's going on Saturday?
no, but
Yeah, we
one
can talk about that, but before we get to that.
I wanted
is-
you know, Ann brought up, and I've talked a lot about the deer culling and that whole
Yeah.
thing with the ticks, and certainly I've listened to and read some articles recently because of Governor Healy's executive order that hunting be open
Right,
on
yeah.
Sunday. So then was a large, I listened to a
Yeah.
whole program on the radio about, you know, that basically, you know, that whole idea again, that somehow opening up Sundays is gonna take care of the problem, and it's
No.
not gonna take care of the
No.
problem.
No.
It needs to be, and nor, I changed my mind after listening to this program, because it can't be a town by town.
No, it
needs
has to be
a
the whole
state.
county, or state.
It has to be the whole state
It's gotta be the. whole
coming up
state,
with a
yeah.
consistent way to do this, You know, whether it's, my husband thinks they have to hire professional people to come in and take.
Yeah.
It's not
Yeah,
gonna be
there
local
are,
people
there are.
that do this, and it has to be a very
There are
thorough.
companies that
And
do
then
it.
followed, I think, followed probably by programs related to the birth control for, you know,
Yeah,
that, so the
Yes.
thought of Bedford taking on culling the deer population of Bedford, I don't want any part of it anymore, is what I'm
Yeah.
feeling, you know.
oh yeah, I mean, I came to that conclusion
Yes,
too.
but
like
it
6
just
months ago,
became
too.
clear, just because I know that we've bandied about trying to figure out, David, for a couple of years about,
Mhm.
because in Weston and Carlisle, they took a stab, and it was a task force, so Board of Health was on it, but there was also DPW, police, you know.
Conservation Committee.
Conservation
But
Committee, the
Weston
whole
did
bit.
hire, they hired.
They did hire, but again, the borders, so you take care of the
I know,
deer, and
so
they're
it's-
just, new ones are gonna move in, so it really
Yeah.
needs,
They're gonna fill the vacuum.
it's gonna fill the vacuum.
Look, there's plenty of food over here.
Yeah,
Now, certainly,
exactly.
certainly what we can do, I think, in moving forward is again, write to MDPH and the governor's office and saying, this
We
is
need
a huge
something.
issue and we
Yeah.
think it needs to be a
We need a
statewide
bill, I
approach,
wonder if we
yes.
could talk to our legislators. I mean,
Yeah.
did we write to them? Did
About
we
this
ever
topic?
write to
Not
our
on this topic.
legislators?
I
No,
believe so.
Maybe it's
No.
time.
but, well, we can certainly say something to Ken and mine.
And it was more about mosquitoes because of Carlisle and.
Oh, right.
Yeah.
That was what we had written
Right.
a letter on.
But I don't want it necessarily to be a goal now, but I just think it's something
Yeah.
to be aware of and
Yeah,
continue
yeah.
to think
Yeah.
about as
No,
well.
The advocacy, right, I mean, it could be a letter to the governor's office, it could be a letter to MDR, you know, I
Yes,
mean,
right.
Oh, yeah.
there's gotta be folks talking about this, we just have to be
Yes.
connected to the
Oh,
right.
yeah.
Mass Fish and Wildlife, I mean,
Right.
they're heavily
Yeah.
involved, that type of thing, even could be one to all of them, you know, a letter just saying. At least we just have to make our voice heard on it.
Yeah,
Yeah.
no, definitely.
Okay.
Anything else? The only other thing I know is switching our June.
Oh, yes,
meeting.
yeah.
Does that work to go the week after for folks?
Yes.
So
Next
what is it? It's,
Yeah.
Instead of 6/1, 6/8.
6/8.
Yes.
For me,
that should be fine.
I will say, I will not be here for the May meeting.
Okay, thank you for letting us know.
Oh, no.
I won't be on an airplane heading to South Korea.
Oh, wow.
It's all good.
The
Yeah.
19-hour flight.
Yes.
Does this work?
Yeah.
Ah,
Okay,
wow.
so we're changing it to the 8th, okay.
The June first to the
June.
June
June
eighth.
first to June 8th. And then I still don't have, hopefully I think Matt was gonna put some proposed dates to the select board tonight, so hopefully we
Oh,
have.
good, so
we
then
can
you
move up
can
Beyond that.
find-
Yeah, that would be good.
For the rest of the year and not be in conflict, cause this room is a little.
I mean, it worked
It's a little-
okay
you know, it's okay
tonight,
to
but
fit in, and it's okay just in general, like, it just doesn't really fit well. It's-
no.
No,
They have a
No.
really nice, I got trained on all the equipment over there, and it's a really nice setup, the way that
Good.
they've done the improvements and everything, so.
I just learned from last year when I first started attending meetings here that once it gets warm, I don't want to be in this room.
Yeah.
Absolutely, you're on 20%.
Yeah.
Anything else for today's meeting?
All right, I move that we adjourn the meeting of April 6, 2026.
second,
Okay.
Okay, so moved by B and seconded by
Yeah.
Anita.
Okay.
All in favor to adjourn?
Aye.
Aye. Anyone opposed? Abstain?
yeah.
500. Thank you, everyone.
Good night.
Thank you.
Okay.
Congratulations, you guys.